Your Healthy Community is underwritten by the Quantum Foundation. Quantum Foundation is dedicated to advancing access to health care and education for the residents of Palm Beach County. Quantum concentrates its mission in several areas to assure that all Palm Beach County residents have access to quality health care at reasonable cost, to improve quality of care, provide support for people with chronic health conditions, and to promote healthy communities and lifestyles through educational programming.
Good evening and welcome to Your Healthy Community. This show is dedicated to finding out what's happening in your own neighborhood to make it healthy and more happy. Tonight, we're talking about your health when it comes to your mouth. Surprisingly, you should probably pay a little more attention to it. Welcome my two guests, Dr. Earl Fox, Executive Director of the Florida Public Health Institute. Good evening. Good evening. And Dr. Phil Bilger, the Dental Director at the Palm Beach County Health Department. Welcome to you both.
Thank you.
And we gave it away a bit with Mr. Bilger's title, but both of you are on the Oral Health Coalition. And Dr. Fox, recently some pretty shocking statistics and research about right here in Palm Beach County when it comes to our mouth. Talk about those a bit.
Well, we have a real problem with oral health disease, particularly among children. We know there are probably 25,000 kids in this county that have dental disease, and almost half of those go untreated. Wow. So we have a real big issue. I mean, this is the most common chronic disease in childhood. It's a big issue.
And when you say the most chronic childhood disease, it's also, I think, Mr. Bilger, you were telling me before, preventable in most cases.
Very preventable. Actually, when we do our sealant project, over half of the kids that we see actually have some sort of dental needs. And most of it is preventable through the use of community water fluoridation, sealants, and fluoride varnishes and good home care, obviously.
And it's not just children who may not have access to dental care. I mean, regular old families, may overlook the necessity of checkups, making sure, as you pointed out, youngsters' teeth have the sealant. Dr. Fox, you've been a pediatrician, so this is your business. Were you surprised by the numbers, or had you kind of expected?
Well, I'm not surprised. I mean, this is a problem in a number of places. As Phil said, the good thing is it's treatable. The bad thing is we're not doing a very good job of it. One of the things that we've got to do, and I think we're not doing very well, is to make, and this may seem a little weird, but to make dental care or oral health care, particularly preventive oral health care, a routine part of going to the doctor's office. And I know when I was growing up, I never, when I went to the doctor's office, it wasn't part of what I went for. But we find that pediatricians and physicians who are giving care to kids can do a lot in their office, not just run education, but they can actually put on fluoride varnishes, which help protect the teeth. We know that brushing and flossing individually have a big effect. So there's a lot we can do that can be done in a setting outside of our dental office.
Why are these numbers like they are? Is it lack of dentists available, lack of insurance to cover it, parent ignorance or caretaker ignorance? What leads to something like this, Mr. Bilger?
I think it's very multifactorial. There's a lot of social barriers, difficulty in finding providers. Sometimes that will take Medicaid insurance. Sometimes it's hard for people to get on Medicaid. There's a lot of different barriers that go on with trying to get access to dental care.
It's also a doctor issue, a dentist issue, I should say.
It really is, Tony. We know that about 20% of the kids have 80% of the disease. I mean, the kids that have the worst problems generally get the least care. And in large part because many of those kids are Medicaid or CHIP eligible. Only 2% of general dentists in a recent survey we did in Palm Beach County will accept a new Medicaid kid. And that's not because dentists are bad, but the rates are low, it's a very difficult process, and there's a lot that the state needs to do to make the Medicaid program more user-friendly for dentists to participate. The other thing that needs to happen is we need more care provided by other trained dental professionals like dental hygienists in settings like schools, daycare centers, and a whole variety of places outside the dental office. So we need to do both.
And is that a legislative thing? I mean, is there laws preventing hygienists from doing some of these procedures?
There are some. I mean, hygienists can provide varnishes. They can put the varnish on, which is a fluoride protective coating. They cannot put a dental sealant on, which is a harder coating. Phil's the dentist, so I may be in deep water here.
No, you're not. You're doing good.
But I mean, we need to do both. But hygienists cannot put a sealant on without the kid first seeing a dentist. Well, they're not able to see a dentist. So what's wrong with this picture? I mean, we need to extend some of the things that dental hygienists can do that they're not allowed to do now. And that's a decision by the state licensing board. And there has been some consideration to doing that sort of thing. So if you had a hygienist who could put a sealant on and who could do other things in a school, then all of a sudden you've got a lot more care that could be provided, a lot more hands out there that could be giving kids what they need to prevent dental disease.
Okay, so that's on the medical side. But what about, let's take it back to home. Okay, let's take it back to home. And Dr. Bilger, I know that the Department of Health goes into the public school system here in Palm Beach County.
Correct.
And in second grade, provides sealants.
Right, we provide sealants to 23 Title I schools. Those are the schools with the highest risk children for dental decay. And we place sealants on the first molars, which is the surfaces of the teeth that have the most decay in young children, on permanent teeth.
But let's back it up. Are there parental duties involved here? That I know, obviously, they still need to get the sealants. They need to see a dental professional. But what can start at home, at what age, to kind of try to reverse some of these numbers in addition to seeing a professional?
Well, I think it needs to really start at a very early age. The minute the teeth erupt, good hygiene, using a toothbrush or a soft cotton roll to clean the teeth off at a very early age, and the use of fluoride toothpaste.
And why should I care? I mean, I have kids and, their teeth are pretty healthy, but why should I care, that my child or my child's friend has healthy teeth? Is it lead to other issues?
Well, it does. I mean, this is part of our whole campaign, a healthy mouth, healthy body, that what goes on above the neck affects below the neck. So that for a kid, it's mainly caries, but you can also have gum disease that you get from not flossing and from not taking care of your teeth. But as you grow up into an adult, it can cause heart disease. If you're diabetic, it can make your diabetes more difficult to control. If you're a mother, pregnant woman, it can cause you to go into premature labor. We know there are a lot of things that dental disease causes now that goes way beyond what happens in the mouth. And so, yes, it's important to develop good hygiene habits. And I have to get this plug in here that, the first tooth erupts at 6 months, but within, at least by the time of the first year, the kid should have a dental visit. I mean, again,
really?
Not everybody's able to do that. But around, 1 year of age is when we recommend that the child have their first dental encounter. And to begin preventive care, counseling with the mother, and to do things that are going to help prevent disease. Cavities are an infectious disease. They're an infectious disease. They're caused by bacteria in the mouth and sugar that eats away the lining of the teeth. And there are things that a mother can do to not let that happen, like don't let the kid go to sleep at night with a bottle with sweet juice, or limit the amount of sugar that they eat during the day, brush after they eat. There are a number of things that really you can start doing as a child that are going to be beneficial to you throughout your whole life.
And that's the real benefit of an early visit, is really that parental guidance, because the parents really want to do the right thing for their child. So by doing these early things, we can prevent decay down the road.
When I know in the beginning you said maybe one way to get that into the regular routine is to have the physician, the pediatrician, do some basic kind of checks. As a dentist, I mean, would dentists be, against that because now they're kind of stepping over into the dental territory?
No, because I think it's an opportunity to educate parents on good dental care. So yes, I think dentists are very much on board and having physicians, especially during the well baby visits, really doing some parental guidance and giving them, early dental visits, the use of fluorides, all the nutritional guidance that needs to go with it.
And Tony, one of the things that we ought to do, and again, I want to get the plug in while we're talking about it, is community fluoridation. I mean, fluoride in a variety of mechanisms, whether it's in toothpaste or whether it's in water or whether it's in a sealant, is good for the tooth. And in Palm Beach County, and I know Dr. Bilger and his staff have been working very hard on this, we only have 62% of the community water supplies that are fluoridated. So we have communities like Riviera Beach, Palm Springs, Boca Raton, that do not have fluoride in the water. And that is the easiest, the best, and the cheapest thing that you could absolutely do. If you had to pick one thing that you could do for a kid to protect their teeth, it's community fluoridation. So, you know, the national standard is 75%. The state is actually at 78%. The state's doing really good.
The state of Florida is.
Right, but Palm Beach County, we need to do some more work. And the beauty of community water fluoridation, it helps everyone of all ages, not just the very young, but the elderly and everybody that just drinks water.
One of my questions, it helps everyone. What if I have problems and I'm a, second grader or a third grader, but then I do get, to somebody who knows what they're doing and can help? Are these things reversible? Because I always worry. I'm not the best flosser, I have to admit. So I always think, oh my goodness, I haven't been flossing all these years, but if I start now, can I reverse the trend? Is it, can you make up for years of bad habits?
Well, yes and no. I mean, one, if you have gum disease and you begin a good program of oral hygiene, flossing regularly, brushing your teeth, you can somewhat reverse that. Obviously, you can't take cavities and go back and undo them. But I think it's never too late to start. And anything you do from an oral hygiene standpoint that is taking care of your teeth is going to be better for your general health care. It doesn't matter whether you started at age 10 or at age 50.
Okay.
I think it's time to reconnect the mouth to the rest of the body. I think that's the important thing.
That's said it very simply and perfectly. And speaking of that, we're going to put up the website, Oral Coalition, and some of the links you have, because I think that is just a wealth of information. And if people want to know more about the dental sealant program, you might want to contact your school, see if it's available. And I thank you both for your time. And this effort seems like we all, no matter if we're a child or a parent, need to hear it. You never hear tips like these too often. Thank you, Dr. Fox. Thank you, Dr. Bilger.
Thank you, Tony.
Again, we'll put up that information here for a minute, and we'll be right back. Well, when we think about health, we don't often think about the end of it. But realistically, if you do plan for the end of life, it's a much easier situation both